Assalamualaikum warahmatullahi wabarakatuh. How are you today? The topic of today's discussion is about nursing outcome classification or NOC. We've already learned about nursing process, nursing assessment, and nursing diagnosis. So it's time for us to learn about NOC, nursing outcome classification. Do you know what nursing outcome classification or NOC is? Nursing Outcome Classification (NOC) is a comprehensive standardized classification of patient or client outcomes developed to evaluate the effects of intervention provided by nurses or other healthcare professionals. How to use notebook? I'm sure that everybody has notebook, so please open your notebook. The first thing that you have to do is list the diagnosis labels to determine their outcomes. Find the suggested outcomes for every diagnosis label in part 4 of the book, Linkage between NANDA and NOC. Choose the suggested outcomes related to the patient's condition. Find the indicators for the suggested outcomes in part 3 of the book's outcome. Choose the appropriate indicators for the patient and choose the possible scale or level. I think you've already been familiar with how to use notebook in Bahasa Indonesia. But if you have to use notebook in English, you have to follow the procedures I've already mentioned before. Now, components of NOC. Number one, a neutral label or name used to categorize the behavior or patient status. A list of indicators that describe client behavior or patient status. A 5-point scale to rate the patient status for each of the indicators. For example, after doing nursing intervention for 2 times 24 hours, the client will achieve bowel elimination 0501 as evidenced by the client's elimination pattern will increase from level 2 to level 4, or the client will compromise an increase on elimination pattern from substantially to mildly. Bowel elimination is as the label, elimination pattern as the indicator, substantially to mildly as the scale or level. How to write nursing outcome? The patient-oriented outcomes should be derived from the nursing diagnosis or patient problem. The outcome should focus on the patient. It's not the outcome of nursing goals. For example, nurse-oriented. Teach the patient how to use walker without assistance. This is a nursing intervention planning, not an outcome planning. Patient-oriented. The patient will walk unassisted with a walker by Saturday. A good outcome uses patient or client as the subject to make it focus on the client. Number 2, clear and concise. Outcomes should be easily understood and to the point. Use indicators with clear criteria or scale or level such as listed on notebook. For example, the patient will walk unassisted with a walker by Saturday. So what is the indicator? The indicator is walk. The criteria is unassisted with a walker. How to write the nursing outcome? The third point is measurable. The outcome should specifically describe the desired behavior so that it can be measured. When outcomes are measurable, observation can be made to determine whether they have been achieved. Let's have a look at the table. Measurable verb. So we have administer, communicate, cough, demonstrate, describe, discuss, all using the verb or what we call as measurable verb. You cannot use non-measurable verbs such as know, understand, appreciate, think, accept, feel, believe. Those are non-measurable verbs and cannot be used when you are writing the nursing outcome. Number 4, time limited. The time for achievement of outcomes should be stated. For examples, by the time of discharge, throughout hospitalization, by the end of the teaching session, within 48 hours, after doing nursing intervention for 2 times 24 hours. Realistic. Outcome should be achievable with available resources of the patient, nursing staff, and acute care setting. Keep in mind such factors as finances, level of intelligence, and the patient's emotional and physical condition. Determined by patient and nurse. Outcomes should be established mutually by the patient and the nurse. When the nurse includes the patient as an active participant in the plan of care, it will ensure the achievement of the outcomes.